You pull the trigger, the entire mechanism trembles, yet no discharge comes out at all. There is only a dry and empty sensation. If you are in your 60s and have just experienced this nightmare known as a dry climax, stop everything you are doing and listen carefully. This may be an urgent distress signal from your prostate, or worse, a sign of a dangerous obstruction that you have been ignoring. Welcome, gentlemen. I am Dr. Julia Hart, a specialist with more than 10 years of experience in men's health and urology. I am here to tell you a truth that very few physicians dare to say directly. The disappearance of semen does not mean your masculinity has died. However, it is a coded message from your body, and if you do not decode it today, you may pay with both your confidence and your long-term health in the years ahead. Before I expose the underlying causes of this unusual phenomenon, I want to know who is here with me. Check in by commenting the name of the city or country where you live. We are a community of men who refuse to surrender to aging. Do not forget to subscribe, because this video will save you thousands of dollars in unnecessary medications. Most men assume that climax and ejaculation are an inseparable pair. This is incorrect. They are two separate mechanisms. When one mechanism continues to operate while the other stops working, that is when trouble begins. So where has the fluid gone? Has it evaporated, or is it flowing backward into a dangerous area within your body? Fasten your seatbelt, because we are about to dive into your internal plumbing system right now. Let us begin with the most common culprit, the one responsible for nearly 70% of dry shots in older men. In clinical practice, we call it retrograde ejaculation. Imagine your urethral system as a junction with two pathways. One route leads outside the body, and the other leads upward into the bladder. At this intersection, there is a gate that opens and closes automatically. More precisely, a sphincter muscle. Under normal circumstances, when you reach climax, the gate leading to the bladder closes firmly, forcing the semen to move only outward. This is basic hydraulic physiology. However, as we age, or after prostate surgery, or due to certain blood pressure medications, this gate becomes loose. It no longer seals tightly. According to simple physical laws, fluid always follows the path of least resistance. Instead of exiting the body, semen flows backward and settles inside the bladder. Ask yourself this question next time. After intercourse, does your urine appear cloudy? If the answer is yes, congratulations, your biological factory is still functioning. You have not lost your masculinity. Your sperm is simply taking the wrong exit. Is this dangerous? From a health perspective, it is completely harmless. You still reach climax and still experience pleasure, only without seeing the final product. However, if your urine is crystal clear and you still see no semen, then we must consider a far more serious scenario. Obstruction. Think of old plumbing pipes that accumulate deposits over the years. Your ejaculatory ducts behave the same way. Over time, scar tissue from past infections such as prostatitis that you may have ignored, small cystic formations, or even tiny stone-like particles similar to kidney stones can develop and block the pathway. In this situation, the fluid wants to exit, but the tunnel has collapsed. The symptoms are very different from retrograde ejaculation. You may feel pressure or discomfort in the pelvic region at the moment of climax. Or you may have noticed that your semen volume gradually decreased over time and the texture became thicker and more difficult to expel. Why is distinguishing these two conditions critically important? Because retrograde ejaculation is usually a manageable side effect, but physical obstruction requires medical evaluation to restore the flow. Do not let tiny stones halt the circulation of your vitality. But if you do not have retrograde flow and you do not have a physical blockage, then who is the true enemy? This one is invisible. It erodes your masculine power from the inside out in complete silence. It is your hormones. If your valves are sealed properly and your ducts are unobstructed yet nothing appears, then we must look at the fuel source. In the male body, that fuel is called testosterone. Do not assume testosterone only helps you grow facial hair or build muscle. It is the conductor that directs the entire reproductive orchestra. It instructs the seminal vesicles and the prostate gland to produce fluid. When testosterone levels fall severely, a condition known as hypogonadism, your factory shuts down because it no longer has the raw materials required for production. How do you know if this is happening to you? Look at the entire picture. Are your muscles shrinking? Is your abdominal fat increasing? Is your mood unstable and your sexual desire at rock bottom? If the answer is yes, then a dry climax is only the visible portion of the iceberg. The good news is that modern medicine can refill this tank through hormone replacement therapy. But now I need you to put everything aside and look directly at me, because what I am about to say is the line between life and death. Never confuse natural aging with a body that is screaming for help. If this loss of semen happens to you suddenly, accompanied by sharp pelvic pain, or even worse, visible streaks of red blood in your urine, that is not aging. That may be the alarm siren of cancer. As a physician, my responsibility is not to soothe you with comforting words, but to warn you of the cliffs ahead. Prostate cancer, when large enough, can compress and completely block the ejaculatory ducts. Bladder cancer located near the bladder neck can create the same effect. In these situations, the absence of semen is a red flag that must never be ignored. Additionally, the silent killer known as diabetes is also hiding in the background. Prolonged elevation of blood glucose erodes the delicate nerves that control the ejaculation reflex. It is similar to electrical wires being gnawed by mice. The signal sent from the brain never reaches its final destination. Neurological disorders such as Parkinson's disease or multiple sclerosis behave through the same destructive mechanisms. Therefore, the golden rule is that gradual changes reflect aging, but sudden changes reflect pathology. If you experience pain, blood, fever, or loss of sensation in the lower pelvic region, stop this video and schedule an appointment with a urologist immediately. Do not wait. In these situations, time is measured in lives. But what if you have been examined and your doctor tells you that you are physically healthy? Then why does the emptiness remain, haunting you, making you avoid your wife, making you feel like a failure every time you step into the bedroom? Beyond tumors or diabetes, there is another enemy that destroys you even faster. It is the self-destructive psychology that quietly corrodes your confidence. I have met healthy, capable men who choose to sleep separately or use fatigue as an excuse to avoid intimacy with their wives. Why? Because they are afraid. They fear the look of disappointment from their partner. They fear feeling like expired goods. They assume that if there is no physical release at the final moment, then the entire encounter is meaningless and a failure. Listen closely. This is the most dangerous mental trap. The truth is that your partner, the woman who loves you, cares far less about a few milliliters of fluid than you think. What she truly desires is connection, presence, and the warmth of your body. Your withdrawal out of shame is what destroys the relationship, not the dry climax itself. So what must you do right now? Do not sit still and endure it. Consider this my 4-step action map for you. Step 1 is to see a urologist. Do not guess. Rule out life-threatening causes such as cancer or infection. A simple urine test can give you absolute peace of mind. Step 2 is to control underlying conditions. If you have diabetes or high blood pressure, manage them carefully. What is good for your heart and blood vessels is equally good for your sexual function. Do not let high blood glucose erode any more nerves. Step 3 is to review your medicine cabinet. Check whether you are taking alpha blockers or antidepressants. Sometimes adjusting the dose or switching medication allows the flow to return like magic. Step 4 is the most important step. You must speak. Do not suffer in silence. Tell your wife, I am having a small technical issue, but my feelings for you remain unchanged. That honesty is more attractive than any physical performance. To close today's video, I want you to engrave this lesson into your mind. The measure of a man is not the milliliters of fluid he releases. It is how he faces the changes in his own body with calm, with wisdom, and without fear. Your body is changing, yes, but your intimate life is not ending. It is simply moving into a new chapter where emotional connection takes the lead. Do not let ignorance steal away the joy of the years ahead. If this video has saved you from long nights of worry, press the like button and share it with a friend or a brother who needs to hear this. Do not forget to subscribe for raw and practical medical insights. I am Dr. Julia Hart. Live healthy, live confident, and take ownership of your body.